Good evening, good afternoon, good morning, wherever you're watching the world, and welcome to Chatham House. Well, in fact, needless to say, it's my study in southwest London masquerading as Chatham House, but we're in lockdown here in London, as I'm sure many of our viewers are as well today. I'd like to welcome you to this special members event that we're having, discussing an extremely important topic, and that's mental health, which you'll see is getting a lot of attention in the midst of this COVID-19 crisis, so, quite justifiably. But today we're going to sort of be talking in broader terms about mental health and the importance of investing in mental health services. I'd like to emphasize that this is a public meeting. It's not held on the famous, using the Chatham House rule. It's on the record, so it's being publicized, and we're very keen for you to tweet and really sort of discuss amongst your friends and colleagues what we're discussing today. We're absolutely thrilled to be co-hosting this meeting with United for Global Mental Health, our partners in this event, who have been doing wonderful work in really promoting the cause of mental health. Today they're just about to do a report, to publish a report on the return on the individual of mental health services. We recognize that a lot of the discussion around sort of mental health and the return on mental health will typically just be looking at the financial return. There's a very well-known formula that $1 invested in mental health services brings a $4 return. But obviously we're recognizing that it's much more than that, that mental health is so important for individuals and society as a whole. So today we're going to be discussing the broader implications of mental health and investing in mental health services. And very much be thinking about how this impacts on discussions around universal health coverage. Sort of coming out of this whole crisis, COVID-19 crisis, it's absolutely obvious there are going to be calls for greater investment in health and in universal health coverage so that everyone's covered. But it's vital that this covers the full spectrum of services, not just infectious diseases, but also non-communicable diseases, including mental health services. And I think, we are seeing starkly the importance of mental health to everyone through this crisis. And hopefully one of the few silver linings out of this will be a realization that we need to invest in mental health. I think we're going to start the discussions today with a short video, and then we're going to be having our panel of speakers who are going to be talking to us about their perspectives. We have a very eminent panel with us today. We have from the Philippines, giving us the view from the Ministry of Health in the Philippines, Under Secretary Myrna Cabotaje, who's going to be talking to us as the Undersecretary in the Public Health team in the Philippines. Then we have Deborah Castell, who's the Director of Mental Health and Substance Use at WHO, the World Health Organization. Absolute vital organization through this crisis, despite what President Trump might have to say. We're all very firm supporters of WHO here. And then finally, we're going to have the corporate view, and we were very pleased to have with us the Chief Executive Officer of Unilever, and that's Alan Jobe, who's speaking to us from Glasgow. And we're really hoping that we're going to have also a mental health activist from Liberia who's trying to join us at the moment, but is having internet problems. But we're fingers crossed that Josephine's going to be able to join us as well. But without any further ado, if I can hand over to Ludovine, who's going to show a video, and then we'll come back to the panel in a moment.
Hello?
Hi,
Hi.
Hi.
I'm from Melbourne,
Hong Kong,
Colombia,
Canada, South Africa,
England.
Every 40 seconds, someone dies by suicide.
Every time someone dies by suicide, you lose all the brilliance they could have brought into the world.
I personally have struggled with anxiety my whole life.
We need mental health to be taken as seriously as physical health.
For my son, for our youth, for our families and our communities.
I'm calling on my leaders to act on mental health because people in Pakistan and all over the world deserve better.
It concerns us all, and greater action is urgent. We need stronger investments in services.
It's about saving the promise, the potential that each of us holds inside and offers to the people around us.
So time to invest should not just be financially, but it should also be human capital. It should also be social inclusion in communities as well.
The world is speaking. We have the blueprint of what works. It's time to invest in mental health.
Thank you very much indeed, the United for Global Mental Health, for that excellent video. And I very much encourage people to read their excellent report that has just been published. So to kick off, I'd really like to hand over, I think, first to Devra, who's going to give us WHO's perspective, but just to say to the audience that we are going to be very keen to get your inputs and your questions that we're going to put to the panel. And I'd like you to use, please, the Q&A function that you have at the bottom of your screen to ask questions. Please don't use the chat, that's been disabled, we think. But the Q&A function we find is the best way to collate questions. So if you ask your questions, we'll be able to bring you in later. So Devra, if I can hand over to you, and if you can sort of give us the perspective on WHO and really the importance of investing in mental health.
Thank you very much, everybody, for having me here and having us given the opportunity to comment on this. I have to say that when I first learned about the report being produced, I thought, why do we need another report highlighting the need for investment? But actually the answer came right away, and the answer is very easy, is because despite the recognition of the dimension of the problem and the implications of mental ill health, we may have read already the numbers in the report, right, of the number of people affected, the burden that it implies, the cost of that for the economy. But despite all of that, mental health remains seriously underfunded. There is approximately 2% of the national health budget globally that goes to mental health. And that's clearly very, very little. So we need a significant investment in mental health, and we need it now. Now, we appreciate that this report outlines different aspects of the return on investment. It's the value of mental health and well-being in itself, the impact that mental health has on physical health, and vice versa. The human rights issues are highlighted, the impact of caregiver mental health on children, all of that on top of the first one that one may think about, that is the economic aspects of the investment, and including then the value of mental health in the workplace. So the report tells us that this is not only for monetary reasons that is important to invest in mental health, but it is also for social reasons or for simply human reasons that this investment is needed. The return on the individual then puts the people at the center of the report and highlights the returns to the whole individual. And so what the report shows is that when we invest in mental health, the impact is seen at different levels. It creates returns on the individual, of course, and then on the family and the communities and the businesses, clearly, and therefore in the society and the economy of the country. Now, more than ever in this moment, we know that the time to invest in mental health has arrived. The COVID-19 pandemic, as we all know, with the health threats to millions of people, the large number of casualties, the physical distancing measures, unemployment rates, the economic and financial crisis that we are all listening or witnessing actually already, the increased violence that also we hear about, all of that poses a great risk for the mental health of the world. Investing in mental health means that we will be able to prepare for the implications of all of these. If we do not invest, we will not have the capacity at country level in the various contexts to be prepared for what's coming. In previous emergencies, we have seen that there may be a possibility for accelerate efforts around mental health, and we have in the past witnessed what we call build back better, right? Developing systems where they were not in many cases. So let me remind us in general that mental health or psychosocial well-being are an integral part of an individual capacity to live a fulfilling life, develop healthy mental and neurological way, form and establish and maintain relationships, study, work, enjoy life, have a good time according to what he or she thinks is worth doing. And this helps making decisions about education, employment, the future, housing, everything. Now, if we do not have that, then the consequences are clear, right? We need to invest in mental health because health, both physical and mental health, is a right. I think that's the first thing we need to remember, is a basic human right, access to health. And that is the rights of individuals that should be at the center of the discussion. The importance is to invest on mental health across the lifespan. We can start thinking about the needs to invest in maternal mental health, women during pregnancy, and then early childhood, and children, and youth, adults, and older adults. The investment should serve to promote mental health. For example, right now, the issues around communication are about mental health, and the implications that the current crisis could have in mental health are very important. But it is also important to invest to prevent mental disorders and to work on those conditions that could lead to suicide, for example. So suicide prevention is very relevant, of course. Ensure access to care for those with existing mental health conditions. You were talking, Rob, about services, and that's precisely what we need. And to make sure that the recovery is possible, no matter where you are and no matter the conditions that brought you to some challenging situation. We know enough about what needs to be done and how could it be done, how all of what I said from promotion to recovery could be done, where, in which, how it could be different from context to context, from country to country, at every level, from the low income to high income. Everything we know how to do. Then the need is to have the means to do that, to make sure that countries will have the capacity, the possibility to do what is needed. So we know then that when we invest in mental health, this will have a positive impact at every level, again, from the individuals and families and the health outcomes in general, communities, business and economy. Individuals will live longer, will be more productive, will have fulfill their potential, have healthier families, and hopefully contribute and participate actively in society. On the contrary then, poor mental health has a negative impact on people's physical health, family, social relationships, but also will impact negatively the family, the society, sorry, at large. We are talking here about the problems of individuals that will have limited capacity, that may be victims of stigma and discrimination, individuals with mental health issues, their family, and then the impact that all of that will have, again, in the community and the society at large, and then the economic perspective. Knowing who was sharing the panel and then the audience, I thought I wanted to spend a few words only on this, the impact in the productivity costs, because we talk a lot about absenteeism and presenteeism, and being the cost of presenteeism often considered in terms of the economic loss, and it makes sense because it's the loss, the cost of going to work but not performing well, as opposed to the cost of not going to work at all with absenteeism. But it was interesting to think in these days, during this time, that we do not always have an easy way of measure to put an economic value to the other effects of going to work when you do not feel at our best because of stress or mental health issues. And for example, in the case of health workers, we can see it's now happening when a health worker goes to work with poor mental health, it's more likely to have what is known as patient safety incidents, right? Or errors, medical errors. And in this context of COVID, that means a serious risk for the person, for the health worker in this case, their own health, and potentially also to others. So what value do we give to that is something that we need to incorporate also maybe in our discussions when we talk about the business around investment in mental health. So in summary, and to make the introduction not too long, I think that there are clearly very good reasons for investing in mental health. We need to enhance the individual and population health and well-being. We need to protect human rights, improve economic efficiency, and move towards universal health coverage, as you said at the beginning. So from our perspective, we welcome the report and we look forward to see it happening. Thank you.
Thank you very much indeed, Deborah. That's an excellent introduction, and we couldn't agree more about, we would like to very much see the recommendations of the report implemented. So to the front line, to the Philippines, and Undersecretary, what's your perspective from the Ministry of Health in the Philippines about the importance of investing in mental health?
Thank you, and hello everyone. We are happy to be part of this discussion involving global mental health, and we are cognizant of the fact that mental health problems will be our next wave of health emergency if countries will not invest on mental health. While our prevalence data will only be available by the end of the year, many of us, we suffer from serious mental illness with epilepsy, with about 60% of people attending primary care clinics, and having almost 1 per 100,000 households with mental disability. And also we all recognize the problem of suicide, especially among our adolescents, with a study that 11.5% of students aged 13 to 15 seriously considered attempting suicide, with 17% actually attempting the suicide. Of course, our problems are our resources. We have limited psychiatrists and very few mental health workers. But what keeps us going are three things. First, we have our Philippine Mental Health Law signed by the President in June 2018, which placed mental health at the center of the universal health care. And the law seeks to improve mental health facilities and to promote mental health education in communities, schools, and workplaces. And of course, we have passed the Universal Health Law last year, which will ensure that every Filipino has access to both primary and special care services. And of course, we have our strategy, the reform strategy in the department, which is the Formula 1 for Health, with a cross-cutting pillar of performance accountability. so that we can provide affordable and quality services. The good thing about our Philippine Mental Health Act is the creation of a Philippine Council for Mental Health. Now, together with the Department of Health, this is the policy-making body organized and mandated by law to ensure setting up of basic mental health services at the hospital and community level. We have increased our services. We are developing high guidelines. What I'd like to zero in is we have a crisis hotline. This was launched middle of last year based at the National Center for Mental Health. And we have trained responders assisted by a pool of psychologists, nurses, senior house officers, and junior consultants. And we have used this platform during the start of the COVID epidemic when we had Filipinos. You know, Filipinos are all over the world. They have been locked down in Wuhan. And this was one of the platforms where our Filipinos in Wuhan were able to communicate with the Philippines in terms of asking some health problems. And we continue to do that all over the Philippines in coordination with our Department of Foreign Affairs. And we have organized a group of duty bearers and stakeholders for the implementation of this Mental Health Act. We are part of the WHO Special Initiative for Mental Health. This is the UHC for Mental Health. And we are committed to collaborate with WHO and other countries in advancing mental health policy. In February of this year, an investment case for mental health has been conducted with WHO, UNDP, and the UN Interagency Task Force on Mental Health. And we look into understanding the economic burden of mental health conditions, its direct and indirect cost, as has been mentioned, absenteeism and presenteeism, the cost of interventions, and the analysis on the potential return of investment. Our preliminary findings show that 3% are government health expenditure. The cost of absenteeism is at 74%. The cost of presenteeism is at 14%. And the losses due to premature death at 9%. In 2020, the combined total cost of the 7 main mental health conditions in the Philippines is estimated at 92.3 billion Philippine pesos, or about 0.56% of our GDP. Our preliminary discussions were to focus these investments have zeroed in on primary health care, which is providing access to affordable medicines with the inclusion of essential psychiatric and neurologic medications and mental health inpatient and outpatient services. In summary, we see the need to scale up our efforts if we want to see some changes. We have challenges ahead, but if we work together and recognize that working together, we can have collective action. We have made progress in including mental health in conversations and talking about mental health as a serious issue. But the next step is doing something about it. We have put an end to the stigma surrounding mental illness and addressed the discrimination faced by those who suffer from mental, neurological, and substance abuse disorders. But even in this COVID pandemic, there is some discrimination that is against the health workers who are helping because people are afraid of them. They do not allow them in their houses, in their apartments. No? So this is one area that we will have to look into. We recognize that to move forward to implement mental health law, we need to bring actors together, and that is what we have been doing in this COVID epidemic, which can be a template for future collaboration. There is an urgency to put our investments in places where they should be, and we hope to see the returns of our human capital. Thank you.
Great. Thank you very much indeed. And I think you make a very good point about sort of the COVID-19 potentially bringing everyone together, and, this has been one of the promising things that we've seen here in the UK. We all take out on a Thursday evening to applaud our NHS workers. And I think, this feeling of solidarity and we're all in this together is extremely important. Alan, if I can turn to you in Glasgow now, it's excellent to see the corporate sector, the private sector getting so involved and interested in mental health. Why do you think that's the case? And perhaps give your perspective. Thank you.
Well, thanks, Rob. Thanks to Chatham House and thanks to United for Global Mental Health for this great report. Unilever, as a big company, has operated for a long time now with what we call a multi-stakeholder model. And what it means is we're not just obsessed with profit maximization and rewarding our shareholders. We believe that if we look after our people, if we look after our customers, if we look after our partners, our suppliers, if we look after society, if we look after the planet, then at the end of that, the shareholder will be well rewarded. And it does begin with our people. And we see mental health as simply an extension of inclusion and equality, building a truly diverse workplace where everybody should feel comfortable to come to work. We've already hit the goal of fully of our 13,000 managers, 50% are women now. And we've been working on anxiety and depression issues for a long time. We've got about 150,000 employees, which means if the statistics in the report are right, that we at any point in time have got about 10,000 employees who are dealing with some kind of anxiety or depression issue. We have been greatly helped by some brave role models and leaders in our company. So our head of human resources, Lena Nair, has championed this. Our global head of learning, Tim Munden, has both championed the issue and spoken very openly about his own struggles with mental health issues. Our global head of R&D, who retired recently, had talked very openly in our organization about how mental health issues had destroyed parts of his family and the difficulties he'd even had with his children. And we have our own video, much like the one that Ludovine opened up with, where we have people across Unilever sharing the difficulties they've been having with mental health. And I think what this has done is it's helped to destigmatize it and make mental health we're working on people with physical disabilities feeling fully included in our company. And in peacetime, we've really got a three-step approach, which is first to support employees. We have a employee assistance program, which means that we're all only ever one click, one call, or one chat away from professional help. We have our global wellbeing hub, pride of place on the front of our intranet site and so on. That's the first thing, is making sure we support employees. We believe our brands can be a force for good. So I won't go into a lot of detail unless anyone's interested, but Lipton, the biggest tea brand in the world, is trying to drive conversations, reopening conversations over a cup of tea. One of our hair care brands, Clear, is helping young people with self-confidence. And Walls, one of our ice cream brands, is trying to promote happiness and neighbors treating each other well. And we think these are contributions to mental well-being. So that's the second thing. And then the third thing is we want to change the system itself through partnerships. Partnerships like Head Together, destigmatizing mental health issues, and also working with United for Global Mental Health, which is creating this evidence-based roadmap for the private sector, and why there's a return on investment and a return on the individual when we tackle mental health properly. That's our peacetime approach. I think we're now in a wartime mode, frankly, with coronavirus. Coronavirus is first and foremost a human tragedy. I had the dreadful news last night that we lost our 5th employee, someone I knew from our research laboratories in the United States. This is killing indiscriminately, and it's creating new stresses. We have about 70,000 people working in isolation from home, and another 70,000 people who are still coming to work in factories or frontline field sales. And we know that isolation and stress issues are going through the roof right now. We've innovated in our community. We're trying to do a lot of communication. And for the last 2 weeks, we've done a global town hall meeting. We had 24,000 people attend. And much like this, we have a chat session and people can ask questions. And fully 10% of the questions were about people struggling with anxiety or stress. And I'm glad we did this because we had the opportunity to direct people to good practices and the support that we're able to provide. And that's, by the way, that does not include the number one question, which was anxiety about jobs. So the 10% was hardcore mental health issues. The number one issue is people worrying about their jobs. I could say a lot more, but I'll pause there just to say this report could not be more timely. It's relevant in peacetime, and it's altogether even more relevant in these difficult days that we are in and that we have ahead of us. Thanks, Rob.
Thank you very much indeed for that, Alan, and deepest commiserations for your poor colleagues. You know, that must be extremely disturbing for you all there. That we're very keen to try and get Josephine to join us from Liberia. I'm privileged to be able to see Josephine on the screen here, but Ludovine, I'm not sure. Is it possible for us to connect to Josephine, maybe via phones? Josephine, can you hear us okay in Liberia?
The issue when it comes to mental health, on how people can invest in mental health in the world, because I don't want to limit it to Liberia only. I think these are things that people need to show up for because it is serious. Josephine suffered from a mental health issue for like 2 years. Although she came in contact with Carter Center, who were helping her, after I saw my 2 parents were being cremated, I lost my mind. I didn't know anything. I never recognized days from months. And unfortunately, I have a beloved brother that I could not even recognize because of what I saw, the trauma I went through at a particular time. But after I came in contact with this organization who tried to talk to me, things started to get better. So this is Josephine.
Oh, I think we might actually have lost Josephine there, but I think that was, we were so glad to get Josephine on. We'd actually hoped to start with Josephine speaking to us about her experiences, and just to tell the audience that, you know, Josephine, you know, survived the Ebola epidemic, but tragically lost a number of her close family and was obviously completely traumatized by that whole experience. And, you know, just really showing how this interaction of infectious diseases and pandemics can really cause great mental health problems. And Deborah, maybe sort of moving on to the questions now, you know, can I ask you, you know, sort of, what are we finding vis-a-vis the COVID-19 pandemic now and the impact it's having on mental health on people? Are we sort of seeing similar things to what we've seen, say, for example, in the Ebola outbreaks?
Thank you, Rob. Actually, you know, we know that in emergencies we see we estimate 1 in 5 persons will have a mental health issue, which is quite high, and this is a very special one, the one we are going through right now. I think one of the main reasons is because it's global. So far, as you said, Ebola was happening in a few regions in Africa, or you have the tsunami happening somewhere far in Asia, or you have things happening to the poor, or things happening to those of some color. Well, right now, this is happening to everybody, everywhere, no matter where you are. One of the issues of COVID-19 now is that it's not discriminatory. It's affecting everybody. Now, some countries better developed were affected first, and we hope that we will be able to learn from that to other countries find how to position themselves on some of the issues. We know that it's affecting everybody because the fear of being infected, or the fear of dying, the fear of having somebody that we love that is infected or could die, but also the stress of caused by not knowing what's going to happen, the uncertainty, whether we will be able and when to go back to work, to go back to our routine, to go back to say hello by hugging somebody. This uncertainty definitely generates anxiety. We do know also that there is a lot of, I don't know if a lot, but there is some stigma and discrimination for people affected with COVID, and that generates further challenges. We know that the economic consequences for everybody, but in some contexts are really very tough if a person cannot go to work on a daily basis. I have a salary, and even if I work from home, others do not. And so how this is going to be faced when in normal circumstances, the unemployment has a very clear link to mental health issues, including leading to suicide. We also have the problems of related to health workers themselves. On one hand, health workers being exhausted and stressed and getting sick. In many cases, that same stress and fatigue will lead to problems, as I mentioned earlier, right? That could make them fragile and then more prone to make mistakes to their own security and to others. Some terrible decisions that they have to take right now they do have already and will have implications on their mental health. We have also the services for people with mental health issues, mental health conditions, existing services that are being empty from personnel because personnel is called to do something else. So what kind of continuity of care can we offer to people with existing mental health conditions, as well as people with other health issues and the needs? Related to continuity of care in general, access to medications, etc. So on top of that, we hear about violence in family context against women, against children. I saw a question there about suicide. We do not have official figures right now. We only have anecdotal stories coming mostly from the health workforce precisely. All that is happening, and to deal with all that, there are already some tools, some messages, some initiatives that could be undertaken by managers, by employers, as we heard before, by governments, of course, and at every level. We cannot delegate anymore to a high level only because there are some priorities. We cannot delegate the care of mental health only to health professionals because they are busy on many other things as well right now. So we need to find modalities and strategies to engage others, to engage the community, the neighbors nearby, to get them a role that will help being better, but also help others being better. And to finish, the telemedicine, the digital technology, with all the challenges that are coming together with that, but it's something that we need to consider. We need to be smart right now, more than ever, to see how can we really expand the capacities of the limited capacities of health system to go beyond that and to reach out as many as possible, because the needs are big, are becoming huge.
Yeah, thank you very much indeed, Deborah. And I think, very important you're emphasizing the role of communities and neighborhoods at the moment. With the formal health services being so stretched at the moment, it is absolutely vital that we reach beyond the facilities and into the communities. Just to remind our audience that we are taking questions at the moment, and we can see questions pouring in at the moment in the Q&A function. So do please ask specific questions of individuals or to the panel in general. And I think you have the function as well of being able, if you see a question you think, oh, that's a very good question, and I was going to ask something similar to that, if you just click on the sort of the thumbs up, then that will get upvoted, and then they'll sort of get promoted up, and we'll be able to spot them more easily, and hopefully then that'll be more efficient with, in effect, answer more of your questions. So sort of maybe sort of turning to some of these sort of questions now, and one that caught my eye a moment ago was from Pakistan, and this was sort of specifically directed at the Undersecretary in the Philippines, and if I can just find it now amongst the sort of the questions that came up, but I think I can remember it. It was, you've been successful in promoting mental health up the agenda and passing a whole act in the Philippines. How do you think that you were able to do that? Because I know that a lot of people in developing countries fear that mental health, hasn't been given the attention it deserves. So how do you think you were so successful in the Philippines, and what might have been the role of civil society in promoting mental health?
Thank you for the question. We had a group of very passionate individuals, mostly from the civil society, who wanted to pass on the Mental Health Act so that we can address not only psychological, even neurologic disorders. And we have in this group also the users themselves, like one of our panelists. It's important that we recognize that from their perspective, they have the right and what they want to have done. But I think it was just ripe when our president was also available. The legislators were cognizant of the fact that we really needed to address mental health issues. Even as I was saying earlier, we do not have the data. No, we don't have prevalence data. We just have estimates, but it's prevalent, and everybody really wanted to get together and have something, especially at community level. So I think that is the difference in the Mental Health Act of the Philippines. We wanted to integrate and have it at the community level, not the high, although there's a referral system, it's not the high consultation with the public, with the specialists. So we want to have mental health integrated at the community level.
Great, thank you very much indeed. I can see that the next upvoted question at the moment is actually for you, Alan, at Unilever. And this is from another Alan Court, and he's asking, with 10% of the issues of the Global Town Hall meeting reporting stress or other mental health issues, how is the company responding to this specifically?
Okay, thanks Rob, and thanks Alan for the question. So the first thing is preventive measures, trying to make resources available to people around mindfulness, around healthy work practices. Some of the work practices on working from home are not intuitive. Many of us don't feel that we're working from home. We feel more like we're sleeping in the office, and we've got to snap those bad practices. And tips on balancing family and work. So for instance, my guidance to the team is take care of your family first and squeeze work into any time that's left over. The reverse does not work. So preventive measures. Second is support resources. We have this employee assistance program where you can phone a number that everyone has access to, or click on a chat and get access to properly trained counselors who can provide first contact care on mental well-being. Third thing is, we're quite worried at the moment about domestic abuse because we're forcing people into a situation where they will spend longer and more time with potential abusers. And we've created quite a world-leading resource for people who might be or are suffering from domestic abuse, with very concrete support on how to get away from that. And the fourth area, I think, is more controversial, which is we're using data and analytics to watch for those who are being left behind. So most of us feel that we are being sucked into a vortex of too many virtual meetings, too many emails, too many calls. But actually, there's a group of people who are not being invited to attend meetings, who are not part of digital networks, who don't have access to comfortable tools and nice offices like I'm sitting in, and we're actually able to, and who are not actually, who are falling behind on email contact and social contact. So whilst obviously respecting individual privacy, we are watching for people using data, tools, and analytics who might be being left behind and feeling lonely and isolated. So if we have prevention tools, resources, watch out for domestic violence, and use advanced analytics, we think we can have quite a good impact on helping our people.
Thank you, Alan. That's very useful and very interesting as well, particularly around the email and sort of the digital access issues. Yes, because there seems to be an overconsumption by some and a feeling of being excluded by others. And I think in this digital age, these are all vital things to take into consideration. The most upvoted question at the moment, very interesting, more than double any others, and this is from Mohammed Ali Hasnan, and who I think may be from Pakistan, and it's sort of directed to the whole panel, but I suppose maybe sort of Deborah might have a view on taking this first, and it's about the role of the WHO and the wider UN system working with governments and international funds to ensure mental health is integrated into the COVID-19 response. So how do you think, the WHO and the UN system can do that with governments?
Thank you very much. And I wish I knew precisely how to do it, which will mean that we will get the resources that are needed. What we are doing, apart from the jokes, is to make sure that in every context where there is a possibility to outline the needs around health, in particular, mental health is embedded. We are talking about mental health and psychosocial support, and we work with a number of other UN and organizations and other NGOs under the big umbrella of the ISC, which is the Interagency Standing Committee, and it is within that network that we are all advocating together for what we call mental health and psychosocial support that belongs to health, but also is related to many other areas such as education, protection, etc. So we are trying to make sure that mental health is precisely as a cross-cutting issue mentioned and incorporated in many different aspects. We are working specifically under the health sector on the different levels of interventions that could be needed. We are trying to make sure that when countries are working on the essential health services that are going to be needed, that are needed no matter what, mental health is included there at its very basic level, but it's there. We are trying to make sure that another important guidelines that is being developed, that is outreach services, that is mostly for communicable diseases like HIV, malaria, etc., but also for areas like us, like mental health and psychosocial support. We are working in communication at different levels to make sure that this is happening. I just wanted to mention that we are also working, I said education, and I was recalling a very nice book that we just launched that is amazing. It's been translated in 90 languages, 90, and it's COVID for children. It's called My Hero and You. Is I don't know if you have seen it, but it's another way of reaching out to parents that will read to children about COVID-19, and in that way then the community gets involved and gets informed as well. If I may, I saw a question that is related to elders, older adults, that I would like also to address, because I think it is very important. We have been listening a lot about how this is one of the groups that is most severely targeted in terms of getting the disease. And I think that it's very important that we don't forget how to make sure that we communicate properly to older adults living in isolation, living maybe in homes, not necessarily with all their functions in good shape, let's say. So many of them may have some challenges, and we need to make sure that we provide information, basic information, but clear information with a very clear language, making sure that they understand and are aware of what is happening. I think that it is important to activate the networks that may be around. I was talking about it earlier. A personal experience, my mother became a widow. My father passed away a few weeks ago, and suddenly, out of nowhere, a neighbor knocks the door and says, if you need anything from the supermarket, I can get it for you. For me, that was an amazing gesture. And I think that with those simple issues, we are making sure that an elder that is only alone at home receives care. If there is no access to social media, and smartphones are not available, the phone is always there. Grab the phone, call, and say what's happening, how the family members are doing, ask how they are doing. Those key communications, I think, are very important. Then if the government is capable of organizing a more supportive system, of course, is welcome. That's
Great.
Something basic I wanted to share.
Thank you. Thank you very much. And now we have a question from Ghana. And so this is, I think, very much directed to you, Undersecretary. And it's about mental health services in the Philippines and what you're doing to support drug users and persons addicted to drugs, now, which I know is sort of quite a controversial topic in the Philippines. And I'm just wondering how you're managing to integrate that into your mental health services.
That is part of substance abuse. Of course, from the health perspective, we always see that it is a mental health issue. It's a problem of the user and not really an abuse. We are trying to integrate more the how to rehabilitate the user, how to prevent them. So it's from different aspects. First, prevention of substance abuse. When they are there, how can they be assisted into rehabilitation? And from the medical point of view, it's really how to assist the one who is problematic, the one who is with the substance disorder, rather than looking at them as what do you call that? Those who are breaking the law, etc.
Mm-hmm. Thank you. Now, here's an interesting one. This might be the last one, I'm afraid to say, but and this is looking at the social determinants of health and in particular causes of mental health. And this is from Jeremy Ross. And he says, you cannot separate discussion on mental health from a discussion on social and economic equality. Surely investment in formal services is less important than social transformation. I think referring here to the social dimensions of health and, you know, the clear evidence that more unequal societies are unhappier societies. So I'm just wondering what the panel are thinking about, particularly coming out of the COVID-19 crisis, where we are likely to see growing levels of inequality, how this is going to impact on mental health services, and how do we potentially move to a more equal society? So I don't know who would like to start with that. Alan, perhaps if you start with that one.
I can have a crack at that. Look, I'm an optimist at heart, and I do believe that the future belongs to young people. And I believe that coming out of the coronavirus catastrophe, young people are going to rise up and be less tolerant of the big problems in the world. And most of the big problems in the world are derivative of two things, which is either climate change and the consequences that that's having on nature, the consequences it's having on water, the consequences it's having on land use. And I think young people are going to be intolerant of an economy that spews out carbon and continues to degrade. It's like the warnings we were having on on pandemics. But the other big problem of our day, alongside climate change, is inequality. Now, because China and India have succeeded in dragging hundreds of millions of people out of poverty, the global statistics are extremely misleading because they say inequality is reducing. But actually, when you click down to national level and look country after country, inequality is actually increasing in many countries. And my optimism is that young people are not going to stand for this anymore. That the power that sits with government, the power that sits with NGOs, the power that sits with business, the young people are going to demand that that is used to address these issues of inequality. And one of the most important dimensions of inequality is inclusion. And certainly at Unilever, and I think at many other companies, we want everyone to come to work, regardless of their gender, their age, their sexual preference, their race, their religion, and their ability status. We welcome people with different abilities into our organization. And so I'm quite optimistic that the young people will be a force for change, social change, and change around equality.
Great, thank you very much indeed, Alan. And I know that you have a hard stop now. I think you have other meetings to attend as well. But thank you so much for joining us today. We really do appreciate your...
Thanks, Rob, and apologies if I slip off. Thank you.
Don't worry, that's absolutely fine. And we had really hoped, as I say, to sort of get more inputs from Josephine in Liberia, but we've been sort of struggling with the connections there. But Ludovine, am I right in thinking that there might be one of our colleagues who can maybe make more interventions on behalf of Liberia?
Hi, sorry, I've just unmuted myself there. We actually have an intervention from one of our colleagues at one of our partners for this event, and the person's name is Neelish. If you would be happy for me to unmute their mic.
Yes, please. Yes, please. Alicia, so please do join us and give us your perspective.
Good afternoon, and thank you very much for inviting me. So by way of introduction, I work at HSBC, so I'm in the similar sector to your panelists who just left, and I also happen to recently have become a trustee on United for Global Mental Health. But thank you very much for inviting me to share my experiences on the work that we have been doing at HSBC and why we have invested in enabling mental health in the workplace, which is really where we're most interested in the subject. But before I do that, I have to tell you I've read the report fairly closely because we've been associated with the Speak Your Mind campaign, which as you know is powered by United for Global Mental Health, and we think there's probably been there's never been a better time for a report like this, just like your panelists said, because something like this needs to inform and influence the thinking, the action that's going to take forthwith. At HSBC, the reason we do this is not dissimilar to Unilever. It's simply because human capital is a precious commodity in financial services, as it is in any sector. And our real journey probably started about 2 years ago, Rob. And our focus has been on driving several outcomes. We've looked to educate our people on the subject of mental health. We've looked to alleviate the stigma that we all know is associated with this subject. And we have fundamentally sought to ensure that the support we were providing our people and their families, especially when they go through bouts of ill health, we look for that to be world class. And like what they did at Unilever, we have ensured that our efforts have been leader-led at the top of the house. So, for example, the Group Chief Executive at HSBC has led that whole dialogue. And when you have a hierarchical organization, as many corporates do, when you start to have these conversations at the top of the house, it starts to make it normal over a period of time. People feel that it's okay, it's a safe environment in which they can start to talk about this and not feel judged. So we have 238,000 people in 60 different countries. We've launched education that we've had specifically curated for us. And importantly, we have had the education curated against the cultural context in which these conversations were taking place. So I'm ethnically Indian. I can tell you that the subject of mental health would have a fairly different backdrop in South Asia to what it would have perhaps in Western Europe or in the Western world. So we were very careful to ensure that the conversations and the education we were having was curated against that backdrop. The second thing we've done is we've really upped our support for our colleagues through the employee assistance programs that we have. So for example, in the UK, we've doubled the outpatient allowance that people have on mental health. And then, of course, we've partnered with United for Global Mental Health on the Speak Your Mind campaign. But all of that having been done, I would suggest to you that we are at the beginning of our journey as a multinational. We've got a ton of work to do. I don't expect our education efforts to support, but critically, Where we can also play a role is education on financial well-being, because we know that there is an inextricable link between mental health and financial well-being, and there's a lot more that we can and should be doing in that space.
Thank you very much indeed, Neil.
No problem at all.
To engage the private sector more, and I think as well, you know, there are certain sectors that we know have a very big impact on mental health, and you know, so say the tech sector as well, and you know, all the issues around safety on the internet as well. You know, so to involve as many multinationals and tech companies as possible, I think is extremely important. I'll basically wrap up then our session today, and you know that we've had interventions from 3 continents, and you know we've had questions from all over the world. You know, which is one of the beauties of sessions like this now, that we're able to do this, and I'm sure that we're going to be sort of working a lot more like this in the future. I personally have learned a lot through you know, working with you on this project, and you know, have found this extremely interesting, and I think that we've all really recognized the importance of mental health, particularly recently through this COVID-19 crisis. I mean, you know, every email you send, every conversation you have at the moment is, you know, how are you feeling? You know, people, you know, very, very concerned about each other's, you know, health and well-being. So let's hope, you know, that, you know, one of the few things that will really come out of this whole experience we're all collectively going through at the moment is recognizing the importance of mental health, investing in mental health, particularly as the likelihood is that sort of coming out of COVID-19, we are going to be seeing countries much more committed to universal health coverage, to that being publicly financed. And then there are going to be big debates about where the investment should be made between communicable diseases, non-communicable diseases, hospitals, community. But I think one thing that we can all be agreed on is the importance of investing in mental health. So thank you very much indeed for joining us today, and best wishes to you all, and stay well and stay healthy.